The AFT. Welcome. This is Brian Lehrer Live, where web video meets the issues. And tonight, where the new National Healthcare Reform Bill meets New York City. Only one member of the city's congressional delegation voted no on reform Sunday night, Michael McMahon, a Democrat from Staten Island and a little piece of Brooklyn. This video might explain his vote in part. It's McMahon trying to moderate his district's October town hall meeting on health care.
Good evening, everyone. My name is Michael McMahon, and I have never been prouder to be your representative in Congress. And when I stand here tonight and see how many of you are out here to talk passionately about an issue that is of deep, deep concern to you, please sit down.
Anyone that believes that the taxes are not going to be raised believes in the Easter Bunny, Santa Claus, and the Tooth Fairy.
With the history of the government running Social Security, the IRS, the Post Office, Medicare, they're all going bankrupt. Why should we let them into the healthcare system when they're just bankrupt?
Why is it so complicated, and what's the rush? That's really all I want to know. Thank you.
My mother asked me the same question. Yes, sir, on number 3.
That people don't have to go to emergency rooms. We don't have to pay $4,000 a night. Send it to a hotel, $250. You could send it to the plaza.
If I get the point, and okay. Yes, thank you, sir. Thank you.
Yes, he got the point. No shortage of loud opposition to health reform, and he voted no. But as it turns out, there was plenty of quiet grassroots support, much of it organized via the web. Shortly, we will hear how Obama for America became Organizing for America, and we'll explore the press strategy. Stay general, the devil is in the details. Then we'll take a break from health politics tonight and see how the tech-savvy Brooklyn Museum gives voice to the people, including the new diverse, socially networked generation.
What do I think of race? I'll be ready when it's no longer a category to classify people based on their accomplishments or abilities.
Video and the Brooklyn Museum later, but first, health and the city. What will this week's historic legislation mean to New York's system of public hospitals and clinics that serve 1.3 million people each year, 400,000 of them uninsured? Alan Aviles is president of the Health and Hospitals Corporation, which we should point out handles 1 million emergency room visits alone from the stats that we've known. Is that about right?
That's about right.
Give people a sense of the hugeness of the city's Health and Hospital Corporation.
It's the largest public hospital system in the nation by far. So we have 11 acute care hospitals with emergency departments. We have 4 very large skilled nursing facilities. We have more than 80 community health centers. We run our own health plan. We have a home care division. We have 39,000 employees. And as you stated, 1.3 million patients served annually, and about 1/3 of them uninsured.
And before we even get to health reform and its effects on your system, does any other city come remotely close to this kind of public health care system?
It doesn't, not in terms of sheer size and the continuum of services that we provide. It's a very comprehensive integrated delivery system, and it's a reflection of the city's commitment to the next best thing to universal health care coverage.
So is this attempt at universal health care coverage at the federal level now good, bad, or neutral for the city's public hospitals?
Well, it's certainly good for the cities, or many of the cities' 1.4 million uninsured individuals, because they're going to have more affordable options to access health care. How good it will be for the city's public hospitals remains to be seen. I mean, there are a lot of moving parts here. Certainly some of our 450,000 uninsured patients will become insured, and that's a good thing. It will bring revenue into our system. But there are an awful lot of our patients who are undocumented immigrants who have been excluded from health care reform and from the coverage, and that's going to be an issue.
And that's worth just highlighting for a minute, because this was one of the contentious things as far as public opposition was concerned, and I'm not sure that everybody knows how it actually turned out. There was never really a proposal in the bill, I don't think, to cover undocumented immigrants.
That's correct.
But in fact, they are not covered. They cannot buy subsidized individual insurance plans under the president's reform.
Even more than that, under the Senate bill, and this is not changed by the proposal on the reconciliation bill, undocumented immigrants apparently will not be able to buy unsubsidized insurance coverage through the health insurance exchanges. So that sounds a little bit crazy, because you're essentially saying that an undocumented immigrant with the financial wherewithal to buy their own insurance at market price can't do it. So if they wind up in our hospitals, we're going to wind up having to bear that cost.
And your policy is never to ask documentation status?
We don't ask documentation status. We serve without regard to insurance status and without regard to immigration status. We've long been the safety net for new immigrant communities across New York, and that continues to be our policy.
Does the bill take that into account? If we are headed toward a country where 95% of Americans have insurance, and I think that's the projection out at least 5 to 10 years from now by the time this all takes effect, such a concentration of that 5% uninsured will be in New York and a few other major cities where there are lots of undocumented. Does the bill take that into account in terms of the funding that would flow to your hospital system as a primary provider for those people?
Well, the answer to that is somewhat complicated, but let me give you the bottom line. So part of the cost of expanding coverage is being paid for by diverting funding, supplemental Medicaid funding called disproportionate share funding, that historically has funded safety net systems like public hospitals. That amount of money that's going to be reduced is about $14 billion over the next 10 years. So it's being done on the theory that if you're insuring so many people, then you don't need to provide the subsidy for the public hospitals that serve the uninsured. But the problem, as you stated, is that you could be in a public hospital somewhere in the country with a relatively low percentage of undocumented, and that will turn out to be the case. Most of their uninsured, or a great many of them, will have insurance. In New York, where there's an estimated 500,000 undocumented immigrants living in New York City, that will not play out the same way.
Just again for context for our viewers, what are some of the big public hospitals in New York City? For people who are not sure, what's public, what private, famous names?
Most have heard of Bellevue and Harlem Hospital in Kings County. There's also Woodhull and Coney Island in Brooklyn, and Jacoby in North Central Bronx, and Lincoln in the Bronx, and Elmhurst and Queens Hospital Center in Queens, and Metropolitan Hospital in Manhattan as well.
And so many people have used one of those facilities or more at one time or another. How active are your emergency rooms for non-emergencies, people coming in for primary care or other non-emergency care because that's their only option?
Very active, like most emergency departments across the city and really across the country. A significant percentage of the emergency visits that we see actually could have been handled by a primary care physician if the individual had a primary care physician or if they were available at the hours that service is needed. So
will this reform mean many fewer people using the emergency rooms for non-emergency care?
Well, you know, I'm sure that is the hope. Certainly, we would like to see that, and I imagine the Congressional Budget Office probably even scored that as something of a savings, because there is an investment here in expanding primary care, mostly through community health centers. There's literally about $47 billion over 5 years invested in community health centers across the country, which is a good thing, and that will expand primary care capacity and hopefully give patients who are using the emergency department other options.
So in sum, for New York's public hospitals, this is evolution, not revolution?
I would say so, yes.
Thank you very much.
My pleasure.
Somehow, health care reform passed despite public fears, corporate lobbying, and the Tea Party. How did it manage to gain support and to garner enough votes in the face of all that? Sure, there was horse trading and arm twisting in Congress, but supporters had their own grassroots, not well publicized like the Tea Party. Many of the president's campaign troops were transformed into an army of volunteers for health care. The campaign organization, Obama for America, the OFA, became Organizing for America, working in neighborhoods knit together on the internet. When this healthcare push launched 10 months ago, the OFA liked the CNN coverage, so they embedded this video on their website.
We're having an open discussion on healthcare. Healthcare that is quality and really affordable.
Thank you so much for coming.
This weekend, the Democratic Party's advocacy arm, Organizing for America, kicked off a campaign-style lobbying effort, hosting meetings across the country to build public support for the healthcare push.
I believe that real healthcare reform is finally possible.
I think more people become involved, they can realize they can make a difference, and it just grows from there.
To get this done, I need your voice to be part of the debate, and it needs to happen now. That's what Organizing for America is all about.
This weekend, the White House enlisted Mr. Obama's old campaign network, organizing thousands of healthcare reform parties from Boston to Los Angeles.
Sorry, I see it every day that people don't have good care.
We know reforming our healthcare system is a huge task, and we know it won't be easy. But the campaign taught us that there is nothing more persuasive than having a friend or a neighbor make the case for change.
Fortunately, President Obama and the Congress has made health care the highest priority this year. And with your help, we can do it, right? We can make health care a reality. Thank you. Thank you.
How does Organizing for America's work actually influence voting in Congress, and what else is on their agenda? Joining us via Skype from Washington, Jeremy Bird, National Deputy Director of Organizing for America. And to help us dig into the details of the health care legislation further and the role of the press in its narrow passage, Trudy Lieberman. She directs health and medicine reporting at the City University's Graduate School of Journalism. She also covers health reform for the Columbia Journalism Review. Welcome to both of you. Jeremy, did you go unnoticed through this whole thing? The Tea Partiers were out getting television coverage all the time. Was there this whole other grassroots network supporting the bill but flying under the radar?
Hey, Brian, thanks for having me on your show. Yeah, I mean, we've been, as you just saw in the video there, that was fun to watch. It was over, almost a year ago when we really first started our grassroots effort across the country with Organizing for America, not just Organizing for America. I mean, there were groups all over in the progressive community working tirelessly. And, one of the things that was really important, and it was very similar to the work we did on the campaign, is that we weren't focused on grandstanding in front of the cameras. We were focused on organizing, on going out, talking to voters, talking to our volunteers, getting them to make sure their voice was heard through members of Congress. And I'll just give you one example. Last August, a lot of the media was very focused on the town halls. Two things were happening on the ground that I don't think was reported very much. Number one, at over 450 town halls across the country where we tracked the number of people that were coming, overwhelmingly we were winning. More supporters turning out, making their voices heard. And the other thing is we had over 65,000 people in 1 week during that August stint go visit their member of Congress's office, to go in and have an individual conversation. And, when Sherrod Brown in Ohio, it's just one example, came back to Washington, he was talking about the 1,100 supporters who showed up for one of his town halls outside of Cincinnati, which is a very red part of the country, in the middle of August. That's the story that a lot of members were hearing in August, not what was necessarily being portrayed in the media.
Trudy Lieberman, you wrote in CJR that the press coverage of the debate and the bill over these many months was practically incoherent to your eye as a press critic. Why incoherent?
Things were not explained in a way that the average person on the street who was coming to some of these town halls, or that I would do my own little town halls in New York and Missouri and other places I found myself. They didn't know what was in the bill. They sort of had a general notion that they either liked it or they didn't like it, but they didn't know what they liked or they didn't know what they didn't like. And I think that's largely a failure of the media to explain this, and we've been urging at CJR.org for a long time, tell people what's in the bill, tell people what's their skin in the game. And that didn't happen for a lot of reasons, and I would argue that the paradigm of the press, what we all sort of grew up with, sort of the general way we do news stories, sort of got in the way, and it's time to think about something else.
Jeremy, I've read that part of the organizing strategy was stick to the generalities of the bill. The devils that are going to turn people off, as well as some of the angels that they might like, but definitely the devils, were in the details. And your team's job was to stay on message about the big strokes of the bill. Is that accurate?
Well, I mean, it depends on what part of the timeline you're talking about. I mean, clearly, back in the spring and summer of last year, there were multiple ideas of what was in the bill. And, one of the way that the president went about this was to say, here are some core principles, that I want to make sure are in the bill, that are core to what I ran on as a candidate, that are core to what supporters out there want to see. And so, I think as it got more crystallized, as it was a clear bill, we were able to really focus much more on the concrete elements that were in there. But what was important to us early on, and if your video was sort of about the time that we started this, was also to tell the stories that were out there. We had about 238,000 people share personal stories with us on our website alone about what we were dealing with and the crisis that we were facing in the healthcare system. And so for us, it was important that, yes, we talk about the details because it is important that people know that, but it's also important that we made it about real people and about their personal stories.
Do you think that people's personal stories had an effect on members of Congress and how they voted, or are they operating on some other political plane?
Well, I mean, I think if you saw the last day of the debate, I guess it was on Sunday, if you listen to a lot, particularly of the Democratic members of Congress, they were talking, sure, about some of the details. They were talking about the 4 million jobs that would be created through health insurance reform. They were talking about the small business tax cuts. But more importantly, they were talking about people in their districts, stories of folks who were facing pre-existing conditions and couldn't get coverage. They're talking about people who had lost their job and therefore lost their coverage. So I think those stories were what in addition to the overall messaging, but those stories were crucial to members of Congress, and they were their constituents.
Trudy, now that the bill has been passed, the press is covering details of the bill like never before. You're laughing. Should they have been doing that all along in the run-up?
Yeah, we would argue that they should. And to help them out, we've had a series going called The Devil in the Details, and we've had 7 or 8 posts under that series, and we're going to continue that, explaining exactly what those details are and how they will affect specific people. We've had tons of stories, and no doubt all of these stories help build the momentum and the support for the kind of reform that we're getting. People sort of had enough. It was really time to do something about it. I think there's no question about it that these stories helped. But what was amazingly absent from the coverage is some of these stories, the anecdotes, I wasn't even seeing some of those kinds of almost our staple making it in some of these stories. And I think now...
You mean people's stories?
Yeah.
Like he was just referring to?
Yeah, I mean, there was some of that, but not as much as I had expected. Actually, in 93, 94, we saw many more stories like that, and they were often cast in terms of winners and losers.
During the Clinton health reform process.
Exactly. And so I would say that now is the time to take those stories and fit the details with those people, because some people are going to find they're going to be helped, and other people aren't going to be helped so much. And I think we need to know that.
I guess with so many of the big strokes in the bill so fiercely contested by the Republicans, the press didn't feel like they had the time or the luxury to drill down into the capillaries.
Well, I think our model of journalism kind of precluded that. We follow the newsmakers, whatever the politicians are saying, the press seems to write that down very stenographically. And I think that that's what they were doing. We were looking for controversy, and we certainly had controversy over the public option. There were lots of people for it and lots of people against it. And that controversy just kind of bubbled up. And then, of course, we have the usual paradigm of he said, she said. And I can't tell you how many stories over the past 2.5 years I've looked at that are, here's one point of view, here's another point of view, and somehow the public's supposed to divine what's really happening, and that's hard.
Jeremy, because of all that ambiguity, do you think that the Obama team has lost the support of many independents who voted for him for president, and even some of the most devoted people in liberal America, progressive America, who thought that this change didn't go far enough.
Well, I think that you know, so many people have tried this in the past. I mean, we've been fighting this battle for 100 years, and I think what you saw by Sunday's vote and what you saw in the signing ceremony yesterday was whether or not you had there'd been a lot of struggle throughout the year on this, and I think some independents, as you said, might have gotten some information that wasn't accurate. I think now folks who have been fighting for this, some of our most core supporters, they see that it paid off. They see that the president never quit. He made it a huge priority. A lot of people told him in Washington, don't do this, it's too difficult. People have tried it before, it's gonna hurt your poll numbers. And he said, I'm not worried about my poll numbers. I didn't come here to get reelected again. I came here to solve America's problems. And
right.
So I think now what you're gonna see, and I think Trudy has talked about this a little, as people really see what's in the bill, they're going to recognize that we are providing health care for 32 million Americans that weren't getting it before. Small businesses are getting tax credits. So many things in there that progressives have been fighting for years, and that independents really believe should happen in this country. So
right, but again, the devil, Trudy, is in the details, or some of the angels. I'll give you an example from my radio show this morning. Okay, we had a caller from a small business owner who employs just 3 people, who said, I offer health insurance to my 3 workers, but they're all young and healthy, and they decline to take it, and they would have to pay a lot of money for it anyway. How is this going to force me to cover them? And the answer turned out to be, from the experts that we had on, tell us if you disagree, that small business owners with less than 25 people who make an average of $50,000 or less will get a subsidy to insure those workers, but they won't be required to insure those workers. Now, if they take that subsidy, it will be on the condition that the employer pay more than 50% of the health care premiums, and then, even with that, the subsidy will gradually phase out over a number of years. I'm sure half of you who just heard that did not understand it. So there are so many details just for small business owners in New York City.
Right. I'm very concerned about the affordability question, and I have written about this extensively, and I'm really hoping that my colleagues in the press begin to look at this too, because some people still aren't going to be able to afford health care as we go forward, even with the subsidies, and particularly people with middling incomes, say 50, 60, 70,000. Remember, the subsidies go up to 88,000 for a family of 4.
You can get on Medicaid up to 88,000 now, can't you, under this?
I don't know about that. I know Medicaid has been expanded, that some people are going to 133% of poverty will be snaring people into Medicaid and childless adults, and that's a very good thing in the bill. But what's going to happen...
That's still only like 20,000 maybe a year.
Yeah, and I think that what's going to happen is people are going to have real problems with affordability at those middle income, and some people are going to have to make a choice. Do I pay this penalty, which is still pretty low, or do I take the subsidy and have to make up the rest out of the family budget?
Right.
And I've interviewed enough families over my career to know that that's tough.
It's still going to be tough. But there was a provision debated for a while, and maybe you know how it made it into the final version, that would actually limit the percentage of somebody's income that they would have to pay for health insurance before the subsidy covered the rest. Is that in there?
Yeah, that's correct. And that a family of 66,000 would have to pay about 9.5, almost 10% of their income on health insurance, which in that case of the $66,000 would be about 62.5, something like that. And then the subsidies would kick in, and the family would have to decide if that is enough of an incentive to get them to buy a policy that's going to have a high deductible and only cover, at that level, 70% of their medical costs.
Conversely, one of the places where the insurance companies and progressives might agree is that the penalties for young, healthy people who don't buy insurance may not be high enough to really incentivize them to pay the extra money to get the insurance policies, and so their money may not be in the system, therefore more tax money may have to be used to subsidize other folks. So is this part of Organizing for America's job now, to go out and make sure that people aren't disappointed with some of the vagaries and some of the imperfections in this, or the too high expectations once it really takes effect?
Yeah, I mean, I think, you know, Brian, one of our key jobs is to go out and, as Trudy was talking about, is to really talk about what's in the bill. There's a bill now. There's no more ambiguity about what may or may not be in there. There's specifics in the bill, and clearly there's going to be additional fixes to the bill coming up soon here in the Senate. But, you know, what our job is to go out there in the grassroots, to have our folks to talk to people who are going to be really affected by this. To gather those stories now of people who, you know, are getting out of school now, for example, and we're otherwise not going to have insurance, who can now stay on their parents' insurance. To be able to share those stories with the American people that are success stories about some change that has been created. The other thing is to really get the information out there so that all this other misinformation and the fear that's been sort of spreading is not dominant out there. And to talk about this being the first step. I mean, the president has talked about that a lot. You know, there's more to go as we move forward. There's still more change that can happen in the healthcare system, as well as lots of other things we got to fight for going forward.
Jeremy, how big is your organizing network? How many people, and how does it compare to the 2008 campaign?
Sure. So, you know, our network, we have both, you know, an online and an offline network, and our, you know, big job is to figure out how to connect those two. Clearly, we have a very massive email list. We've also got, you know, several million members on Facebook, Twitter, you know, in all 50 states and all 435 congressional districts. We also have, you know, staff in all those states, volunteers in every single congressional district. And so, you know, we're massive, and people had, you know, continued to stay engaged after the campaign. We've even seen new people come in, you know, over 1 million new emails just in the last year, significantly over 1 million of people who weren't involved in the 2008 campaign, but really care about healthcare, for example, really care about financial reform.
True to you, also followed for CJR, I believe, a grassroots organizing effort by the insurance company WellPoint, which is the parent company for Empire Blue Cross Blue Shield, for example. Right. Can we say an insurance company organized a grassroots campaign?
I think we certainly can, and they were really quite effective at it. I have been watching their weekly updates to their grassroots group since last June, and finally put it all together and kind of analyzed what was happening. And they were very factual in what they said. That's not to say that there weren't subtle messages here and there, as I pointed out in the piece that's been on the website this week. But they started out very early with their grassroots campaign, and there may have been others. This one just was very public.
And then they shot themselves in the foot by going out and raising their rates by 40% for people in California just as the final debate was about to take place?
Yeah, one could say that was very ill-timed on their part. Nevertheless, I think they're going to come out just fine. WellPoint will continue to sell its policies in the individual market. It will be able to sell across state lines, and it will still be able to raise its rates. And so I would say that they are not going to lose very much.
And by law, everybody's going to have to buy their product or a competitor's.
Big influx of new customers.
Jeremy, before you go, what's your next organizing task? Is it too big to fail reform, or what is it?
Well, I think it's we're always going to be walking and chewing gum at the same time. So we've got to make sure that, as you said, as we talked about already, we've got to continue the health insurance reform fight. I mean, it's not over just because the vote was cast. We've got to make sure that we get the fixes in the House bill through the Senate. We've got to make sure that, you know, we continue to organize all across the country, get the message out. We've got huge celebration events, thank you events for members of Congress who stood up and really, you know, cast a courageous vote last week. We've got Wall Street reform. We've got to make sure that the folks who got us into this mess with the economy, the banks, and et cetera, that reform gets passed. And we've got big elections coming up where those folks who have stood up for the president, who have stood up for change, we want to make sure that, you know, we're standing up for them. And so just on the healthcare fight alone, we had 9.4 million hours where volunteers said, we're going to pledge those hours. You fought for us, we're going to fight for you in 2010. That's just a little bit of what we'll be doing going forward.
So it ain't over till it's over, and it's really never over, is it?
It's really never over. I mean, there's a lot, you know, change doesn't come easy, and this was a long, hard fight, but we're going to keep fighting. We're not going to quit. We're going to keep making change in this country.
Jeremy, Trudy, thank you very much.
Thank you.
Brian.
This is Brian Lehrer Live, where web video meets the issues, and Here are this week's 5 online video picks. Number 1, you have heard about the ugliness surrounding the health reform protest over the weekend. People spitting on one black congressman, shouting a racial slur at another, and a gay slur at Congressman Barney Frank, plus an actual Republican member of Congress from Texas shouting baby killer at Democrat Bart Stupak, and Republican leader John Boehner saying health reform will ruin our country. He used those words. What you may not have seen is this video shot by the Columbus Dispatch newspaper of Columbus, Ohio. It shows Tea Party protesters reacting to a man with Parkinson's disease who sat down with a sign supporting reform.
At one point, a man whose sign said he had Parkinson's sat down in front of healthcare opponents.
If you're looking for a handout, you're in the wrong end of town. Nothing for free over here. You have to work for everything you get. Good to know.
No, I'll pay for this guy. Here we go. Start a pot. I'll pay for you. I don't want a handout. I'll decide when to give you money. There, there's another one. There you go.
You love a communist.
No more handouts!
Well, on the web just today, the man in the shirt and tie there has apologized and said he was ashamed of his behavior. But yeah, if we didn't have sick people like that guy with Parkinson's, we wouldn't need a health care system, would we? So video pick number 2, after the incident, the protester with Parkinson's speaks.
Parkinson's is like having 7 lions walking around behind you all the time. You're always scared and frightened and shaking, and I've had it for 15 years roughly. And right now I have a hard time talking, and I have a hard time walking. You know, I went over to the rally not expecting to have anything and everything. I figured no one could be safer than me. I was there to kind of testify to my position. People complimented me for being there and said how brave I was. But honestly, I didn't feel brave. I said, so my answer is thank you. It seemed like the right thing to do. I had to tell people that I had been diagnosed with Parkinson's. My whole family cried. My mother couldn't sleep at all that night. Then when I had my surgery years later, we all cried over again, over how much what a miracle it was. And that's, I guess, what we're talking about here. Families that cried together. How many more of them will be crying together in happiness over the successful performance of this surgery?
That interview and video from Progress, Ohio. So what comes now? A toning down of the rhetoric, perhaps? Well, video pick number 3 previews the November 2010 election campaign theme of the Republican Governors Association, which released this video.
The American people don't want this big Pelosi plan.
We will have health care one way or another.
We don't want what you're trying to ram down our throats.
8 times you said that negotiations on health care reform would be conducted with the C-SPAN cameras.
John, election's over.
And the Democrats intend to lead the most ethical Congress in history.
Democratic Congressman Charles Rangel announced today he's stepping aside just days after the Ethics Committee admonished him.
It's bad immediately with the 10% that are unemployed.
If this is the change we all can believe in, America's best days are behind her.
Oh, my.
President Obama, are you listening? What do you think of stimulus is?
America, we can do better.
225 years, you've had the courage to do the unthinkable.
The citizen is boss. Through the Governors Alliance, the Republican Governors Association is looking to humanity's best asset, the individual citizen, for the answers to the great challenges of our generation. Believing in the strength, not of Washington, but of the states, our local communities, and one another to lead our country forward. From the team that helped bring back New Jersey and Virginia.
We must act today in order to preserve tomorrow.
Join us as America once again triumphs.
So if you like politics and rational discussion, the fun is just beginning. So let's think about something else. Doing a Google search has become such a part of everyday life, though maybe not in China, that you might not even give a thought to how it's done. Google made this video to explain it.
Now, suppose I want to know how fast a cheetah can run. I type in my search, say cheetah running speed, and hit return. Our software searches our index to find every page that includes those search terms. In this case, there are hundreds of thousands of possible results. How does Google decide which few documents I really want? By asking questions, more than 200 of them, like, how many times does this page contain your keywords? Do the words appear in the title? In the URL? Directly adjacent? Does the page include synonyms for those words? Is this page from a quality website, or is it low quality, even spammy? What is this page's page rank? That's a formula invented by our founders, Larry Page and Sergey Brin, that rates a web page's importance by looking at how many outside links point to it and how important those links are. Finally, we combine all those factors together to produce each page's overall score and send you back your search results about half a second after you submit your search. At Google, we take our commitment to delivering useful and impartial search results very seriously. We don't ever accept payment to add a site to our index, update it more often, or improve its ranking.
So let's try this search on for size, horse-drawn Hummer. It's an art project by New York-based Jeremy Dean.
In the 40s and the 50s, the car did make America, but here we are 50 years later, and we've kind of taken that to its logical conclusion with a car that gets 9 miles to the gallon.
A vivid tribute to the American scheme of living. Come, let's travel into the future. What will we see?
Got done touring through Central Park with a pair of white Percheron draft horses, so it was really important for me to see it actually work in that way to make the statement we were trying to make. That's what art does, you know.
You know, they discontinued the Hummer, right? So the Hummer and buggy whips are now in the same historical category. That video put together by the artists collective called Creative Thrift Shop. By the way, the artist calls his contraption the CEO Stagecoach. And because he put a lot of his own money into that project, we understand that that 2-horsepower Hummer can now be yours for $100,000. And those are this week's online video picks. Coming up, the always creative Brooklyn Museum embraces social media. This is Brian Lehrer Live.
This is CUNY TV, the City University of New York.
Did you know that there are 8 national parks in New York City? There are also 8 parking spaces in New York City. But that's something else. New York City has Federal Hall, where George Washington became our first president, the Statue of Liberty, and Gateway with beautiful beaches and protected wildlife. New York City has a range of national parks you won't find anywhere else, because you cannot move a national park. It's a park. Even if you wanted to get it out of here, you couldn't. America's spirit lives in our national parks.
Ma, guess what? I went back to college. No, I didn't quit my job. I'm finishing my degree with a CUNY Online Bachelor's in Business. I interact online with real City University of New York faculty on a schedule that fits my busy life. Ma, you should look who's teaching at CUNY. And it all leads to a high-quality Bachelor of Science degree in business. I can attend class anywhere, anytime. Yes, Mom, even at your house Friday night for dinner.
The CUNY Online Baccalaureate. Get back to business.
This is Brian Lehrer Live, where web video meets the issues. Now let's turn our attention to one of the city's venerable cultural institutions, the Brooklyn Museum. There have been plenty of exciting goings on there in recent years, from the founding of the Elizabeth A. Sackler Center for Feminist Art, to the dance parties that happen there the first Saturday of every month, to the fountain out front, now one of the premier spots in the city for overheated kids to cool off in the summer. But interesting digital things have been happening at the museum as well. Shelley Bernstein is the museum's chief of technology, and although she drives a 1974 VW Beetle, far cry from a Hummer, this Red Hook resident is all 21st century. She has put the museum collection online and socially networked the place into the electronic fabric of Brooklyn and beyond. Welcome.
Thank you.
So first of all, on putting the collection online, people don't actually have to go to the Brooklyn Museum anymore to see the art from the Brooklyn Museum.
Right. Well, you know, we have to realize that the building itself is finite in terms of space. So there may be 5,000 things that we can sort of put on view, but we have a huge collection that sits in storage. So, you know, if we're a community-minded organization, we want to put that out there on the web and make it searchable and let people sort of enter our doors virtually, even if they, you know, hope that they come in, but, you know, they can also see us online as well.
Probably tease people's interest, I would think, if you see something online and you think it's beautiful, or just evokes some kind of reaction in you, and you know you can go see that thing in person, maybe you're more likely to do it.
Exactly, and I think one of the things that we're really concerned about online is when you look at a record like this, making sure that it's very clear that this item is on view.
Why don't you go up again to the image? Can you do that?
So this is a work by Fred Wilson, a Brooklyn artist, and this is on view in our contemporary collections. And I think one of the things that we're extremely concerned about is when you put things online, that if you, to sort of do it in a way that makes sense. So as someone's browsing this record, it's very easy for them to see this item is on view. So they know that when they get there, they're going to be able to see it.
Now, I also gather that you're using crowdsourcing, which I guess in this case means using your museum patrons to tag the collection. How does that work?
Well, take an image like this. This is a great image. This is part of our collection of the Elizabeth A. Sackler Center for Feminist Art. But look at the data that's online about this image. There's nothing here that describes the image or helps people figure out what this image is. So what we do is we invite the public to come in virtually and tag this image with their own wording, and they tag it things like pregnant, weird, bare feet, hospital, tattoo, and suddenly when you start to search online, now just because our metadata is not necessarily as good as we'd like it to be, now we have these descriptions that people can now find this object online.
Right, so just regular viewers thinking what words come to mind that they would put as the tags or the keywords for people who happen to be searching. That's your hope, right? That people who are just searching pregnant or whatever without the Brooklyn Museum in mind will stumble upon this image.
Absolutely, and I think that we have to recognize that how we professionally describe an object is not necessarily how someone who's not a professional would necessarily search for it.
What's the Brooklyn Museum Posse?
The Posse is an online group of people, basically, who tag our collection. They moderate comments, and they all have profiles. So like here, you can see these are the people who are online who are helping us to tag. I mean, this, I love Nina, 7,915 tags. It's this is a pretty awesome commitment. So we want to encourage people to do this and give them an identity so that all of their contributions are attributed.
These posse members are members of your public, not members of your staff.
Exactly.
You know, in journalism, sometimes there's a debate over whether we're either exploiting people when we ask them to do things like that, or using them in lieu of people we should be paying.
Well, I think, you know, the great thing about the Brooklyn Museum is our mission, and our mission is very community-oriented. We try and engage our visitors on a number of levels. So, for instance, you know, we may engage people this way online, but when people come into the building, we're also interested in their feedback, because what we want is to make the visitor experience better. And we can only do that by asking people what they think.
And you're also working on a gallery guide that uses mobile phones called the Brooklyn Muse.
Exactly, and it's the same idea. As you go through the museum with Brooklyn Muse, what happens is, as you choose things to like, it spits out recommendations from other visitors. So it learns your preferences as you go, and then takes that data and reflects it back for others.
And you also use, in the museum, YouTube quick view kiosks, quick capture kiosks.
Quick capture kiosks, right? Yeah. We did this for a show called the Blacklist Project, and this show was a show of portraits by Timothy Greenfield Saunders and Elvis Mitchell, and the education department came to me and said, look, you know, we want to hear from our visitors. This is a great show to do it with. We want to ask them about race. How has race impacted their lives? So that we sort of bring to life this idea that not only are these famous people on the walls, but we have a community here and we want to engage them and we want to hear from them. So what we did is, we had no time to put the project together. We rigged up these kiosks using a MacBook and YouTube's quick capture feature, which just lets you record videos automatically to a YouTube channel. We put it in the galleries and set up a YouTube channel, and hundreds of people came in to record their videos. And I think we have one to play.
Yes, we do. We have an example of one of those YouTube quick capture videos from the Blacklist Project, recorded at the Brooklyn Museum. Let's take a look.
What do I think of race? I'll be ready when it's no longer a category to classify people based on their accomplishments or abilities. I'll be ready to do a good job, have someone say that it was a good job, and not just a good job for a mixed person or a black person or however someone else chooses to classify me. I think that I'm proud of where I came from, but I'm also ready for it to not be a label and a tag, a category, or any other sort of qualifying feature. To know the race of someone in a story, or to know the race of someone when it comes to politics or who they are as a person. It doesn't add any weight to what someone's saying, and I think it's a useless way to tag and classify. And I'll be ready for the word to cease to be a part of our culture, and I'll be ready for the race itself to end.
So what I love about this example is this idea that it was a completely lo-fi solution to a problem that we had where we needed to engage visitors. And the greatest thing about it was sort of walking downstairs and seeing people in tears, completely opening up on YouTube, basically, and sort of being able to enable that process was pretty powerful.
Just wanted to see people cry.
Yeah. Ideally, we don't want them doing that in the galleries, but
and
you know.
It blurs the line between artist and visitor, right?
Yes.
Who's making the art and who's watching the art?
Sure. You know, it's community engagement. If our mission's about community, then a big part of that is sort of letting people participate.
How many of those in that race project have you gotten?
We had 400, 500 recorded.
Oh, that's a lot.
Yeah, it was quite a
And who sees them? I mean, are people
online.
actually go? I know they're online.
Yeah.
But then are people actually going and watching, you know, sampling from this collection of 400, 500 videos
Sure.
from the Blacklist Project?
Sure, and you know what we were doing is on the web, when people would come to the exhibition page, they would see these videos. So all of a sudden you were seeing sort of the community voice in tandem with sort of the curatorial voice.
Another way that you're using social media is what you call the Flickr Commons, correct?
Flickr Commons is this great initiative by Flickr.
And for people who don't know, Flickr is kind of a photo platform. People upload their photo collections or selected photographs to a website called Flickr. It's kind of YouTube for still photos.
Exactly. And they have an area where you can, as an institution, upload photography that's no known copyright, and sort of put it out there in a space where people really love photographs. I mean, it's great to have our collection online, but we can't expect that everyone's going to come to brooklynmuseum.org to see it. So if we can put the collection in a place where there's a group of photography lovers who really want to see it, going to them and extending our hand and saying, hey, look at these collections, offers the chance to make them more visible. And it also, because Flickr is a social network, it allows people to contribute back to our collections. We've had a lot of records corrected, and a lot of tagging the collection that way.
How about Twitter? Using Twitter?
We are using Twitter. One of the things we want to do with Twitter, if you shoot this screen, we want to take a social networking space and put good content in it. We don't want to just, it's not marketing, it's not PR. So, you know, for instance, we were out on Twitter and we had 4 mummies going to a local hospital to be CT scanned. And we said, you know what, let's bring our audience with us. And what we did is we were putting the images out on Flickr.
You said that just like it's a normal thing. You had 4 mummies,
4 mummies
going to a local hospital to be CT scanned.
Yes. Because our conservators wanted to see basically what was inside them. They're about to go on view. They're doing this huge project. I said, wow, that would be great for Twitter. Let's live tweet the whole thing. And we were uploading pictures to Flickr. We were uploading tweets to Twitter. And the great thing about this is if you shoot this, halfway through this, this CT scanning, we discovered that some of the mummies that we thought were women were actually men. And the great thing about it is on Twitter at the same time our curators were learning about this and our conservators were learning about this, our audience was learning about it too.
Did the mummies have health insurance?
Good question.
And you're using Foursquare.
Yes, we are using Foursquare. Foursquare is a social networking kind of game that you play on your phone, but the great thing about Foursquare is when you check in at a place, you can register that you checked in there and you get points. And the great thing about Foursquare is that it allows us to sort of take the virtual space and the physical space and merge them. And we're always trying to do that.
These initiatives go against the traditional image of an art museum as being for an elite. And at the same time, maybe this is all for another kind of elite, the technological, wired elite.
True. But what's interesting is the tools are now so easy to use that we're seeing a lot of diversity in the people who are using them. So for instance, in the YouTube kiosks, we saw a Holocaust victim record a video. And online on our blog, we're hearing from a 90-year-old woman who is the last inhabitant of our skank house. So we're definitely seeing lots of movement across the board, and I think it's about being inclusive all across the board, not just with the tech and online, but also when people come into the building.
You have one last image to show us by any chance? Anything cool you want to call up from your own collection?
All right.
We've just got a few seconds. And I guess you're hoping as you're doing that, that perhaps teachers in public schools and other places will find their way to this and start showing kids this kind of thing?
Of course. I mean, that's the whole point of putting it out there.
Oh, what are we looking at?
So we're looking at Kiki Smith installing her recent show, Sojourn, and she's literally glittering in the exhibition space. Like when she was installing, I was there with my little still cam taking some video of her working on her piece, and all of a sudden it's out on the web and people can see it.
Great stuff in the Brooklyn Museum and in the cloud. Thank you very much.
Sure thing.
Finally tonight, in the digital era, Penguin Publishing stares into the abyss, the future of books. Watch closely.
This is the end of publishing, and books are dead and boring. No longer can it be said that we like to read. My friends and I, we don't like the way books feel in our hands. It's not true that I don't follow trends. I know what I want when I see it, and packaging is more important than content. I have to tell you, my attention span is too small for big ideas. And it's just not true that I read a lot and I like learning. I don't care. And you should never think I've got to be concerned with environment and sustainability. What I really hope you get is you've got to open your eyes to my values. What's important to me is what Lady Gaga is wearing. And I don't really care all that much what Gandhi did last century. I think it's unbelievable that you're actually listening to us. What's important for you is you'll find customers for your products. You think your job's done if we like your brand. We'll do it for you on Facebook, on our mobiles, me and my friends. Your market is dying. Don't think it's all going to survive. It is the end of the publishing industry as we know it. Unless you reverse how you see me. It is going to survive. Don't think that it's all dying. Your market is me and my friends. On our mobiles, on Facebook, we'll do it for you. If we like your brand, your job's done. You'll think of products for your customers. You'll find what's important for you is that you're actually listening to us. I think it's unbelievable what Gandhi did last century. And I don't really care all that much what Lady Gaga is wearing. What's important to me is you've got to open your eyes to my values. What I really hope you get is I've got to be concerned with environment and sustainability. And you should never think I don't care. I read a lot and I like learning. And it's just not true that my attention span is too small for big ideas. I have to tell you, content is more important than packaging. I know what I want when I see it, and I don't follow trends. It's not true that we don't like the way books feel in our hands. My friends and I, we like to read. No longer can it be said that books are dead and boring, and this is the end of publishing.
Show week this for it's that. Or reverse, that's it for this week's show. We're here live Wednesday nights at 7:30 or anytime online at brianlehrer.tv. Next week, technology, tuition, and the future of higher education. And tune into my daily radio show, 10 a.m. on WNYC Radio, tomorrow morning, how health reform might affect New York's seniors. That's 10 a.m. on WNYC 93.9 FM and AM 820. Talk to you then.